I'm Graham MacGregor. I'm Professor of Cardiovascular Medicine at the Wolfson Institute. I'm also Chairman of Blood Pressure UK, formerly known as the Blood Pressure Association. And we set that up in 2001. And the reason we did this is because blood pressure is the biggest cause of disability and death in the UK. And by seeking it out and treating it, we can prevent people developing strokes and heart attacks and heart failure. And that's really our major aim, is to prevent people dying unnecessarily from high blood pressure. Although we have very good evidence that treating high blood pressure is very beneficial, we're not very good at delivering that care, and people's blood pressure doesn't get controlled. Many of people are still in the community undetected, and the first thing they know is to have a stroke, which can, if you survive, can be a terrible thing to happen to you, half paralysed, having to be looked after by the state and your relatives the rest of your lives. Or you get a massive heart attack, if you're lucky survive, but then you go on to have heart failure, where you eventually die because you're drowning in fluid in your lungs, which is not a very pleasant way to die. And we can prevent these. This is the point. We get better control of blood pressure. So that's what we're about. Well, we want everyone to be aware of the importance of blood pressure, indeed have a blood pressure monitor at home, so everyone knows in the family what their blood pressure is. Much more important than knowing what their weight is, because you can see what your weight is by looking at yourself. But we also want better treatment, better control, better knowledge, and better knowledge of what individuals can do to prevent the development of high blood pressure and to help the tablets work and realise how important those are. Well, clearly to do programs like this, we desperately need some money. We have in fact, very little money. We do everything on a shoestring, very well run organisation, but if we have a bit more money, we'll be able to do so much more in preventing people dying from strokes and heart attacks and heart failure. So I really would like to ask you to seriously think about giving us some money, because it will help us to fulfil our role and get strokes and heart attacks prevented. Thank you.